Hello and welcome back to the Hot Pot. For this month's episode, we'll be highlighting our 20 by 20 Navigator Program partners. The 20 by 20 program highlights 20 community-based organizations that are doing incredible work in the AA and HPI communities. It uplifts the community health worker, patient navigator, or Pacific Islander navigators within each organization. Community health workers are frontline public health workers and have been doing incredible work to make sure that our communities have equitable access to care. So here's a highlight video showcasing all of the work that they're doing.
The 20 by 20 Navigator Program provides vital help to AA and HPI communities in navigating the health insurance marketplace, enroll in Medicaid and Medicare, and access the health services they need.
So there's many barriers, unfortunately, within our community that affect community members, from the stigma, starting with the stigma of even sharing that they need help. And then once we go into community outreach and education, there's still a barrier in which that there's hesitancy to reach out and ask for help.
There was a huge influx of refugee population. All of those people had multiple needs, but what we find that they struggle most with the healthcare navigation because they find the American system of healthcare very complex. And because of their previous country or their current situation, like coming out of the war situation, they have very complex healthcare needs.
There was little to no access to healthcare for community members that did not have an English-speaking relative or someone that could go with them to their visits. A lot of even the major hospitals along the Gulf Coast did not provide interpreting services, and if they did, it's very limited.
The 20 by 20 Navigator Program ensures that AA and HPI communities have access to the care they need by increasing the skills and availability of community health workers and patient navigators to provide education, counseling, and facilitate enrollment in health insurance plans.
We are frontline public health workers. We are organic from our communities. We basically act as the liaison between the healthcare system and our community members. We assist our community members in navigating the healthcare system just to ensure that they receive healthcare access as well as quality care.
We live in the community with the older people with lacking of technology and language barrier. So we is the one that make connection with them.
With us immigrants, there's this attitude of like accountability. Like, who is accountable to make sure that these people are getting access? It was evidence during COVID. We're the best to do that because we know our community better.
This resulted in a diverse group of communities being served in regions throughout the country.
I have a group of Chinese senior Cantonese speaking. We come every month. We do a community education luncheon. In this way, the community who understanding the issue and then knows about the importance that we emphasize every single one. So in this way, we can really mobilizing them and also make sure the lead and the voice be heard, and then the city council knows about them. So they have a space opening for them to do services.
So being a navigator and assisting community members with their healthcare enrollment needs, even if it was for a very short period of time, it really allowed me to educate and engage our community members in advocacy efforts. And that was the most important part, to be able to educate them and give them the necessary tools and resources to be able to carry out that work on their own.
I think we assist over 2,000 families accessing, or at least get the affordable health care so they can see doctors. Prior to that, many people did not have the opportunity to see the doctor because, one, they don't speak English. Second is the cost. It costs so much for them to see the doctors. I would say that 80 to 90% of the community members now have an opportunity to get quality of care, seeing a doctor on a regular basis. Thanks to the CBO program, where We do a lot of education about chronic disease, management prevention, and healthcare education. So that in turn help our community members, access or understand, the needs to have their healthcare as a primary, needs in order for them to continue to be healthy.
Our ultimate goal is to assist as many eligible people to get covered by public health insurance via outreach and educational activities. In this regard, the 2020 Navigator program helped my coworkers and navigators learn about various outreach strategies and how to advocate for the community. First, we connected to the local governmental entities. We developed 3 Korean materials to promote marketplace insurance and inform about Medicaid renewal, and disseminated them via KCS social media platforms and Korean American ethnic media, and educational workshops focused on the Medicaid unwinding process. We also raised awareness about the importance of health coverage, and this ultimately enabled us to assist individuals and families in need.
My greatest hope for the community we serve is community resiliency. I hope that we can continue working together with other communities who are experiencing similar challenges to ensure that the needs of our communities are being met collectively. I hope that we can recognize that despite our diversity and differences, we're still working together for the same goal, and that's healthy families and healthy communities. And our organization has been a leader in many efforts for our community members, and I hope that we will continue to advocate in collaboration with our community members for the tools and resources that are necessary to help them lead that healthy lifestyle.
How incredible was it to learn from our partners? Again, they're doing such incredible work, so thank you to our 20 by 20 community-based organizations within the program, and thank you to all of you for watching and making sure that we uplift the AA and HPI communities. Until next time.